Hi, my name is Kamaljit Kaur.
Hi, my name is Harmeet Singh. We're from India.
I was diagnosed with Placenta Previa grade 4 during my second pregnancy.
We were referred by Dr. Smita from the Prime Clinics to the consultant gynecologist at Prime Hospitals, Dr. Usha. My wife was in a very bad shape. I believe
It was very heavy bleeding at that time and we were very scared.
Kamaljit was referred to me by Dr. Smita. She was previous cesarean section with a central placenta previa, which is a very high risk condition. It's high risk because patients can't have a normal delivery in this situation. At the same time, even during cesarean, they can bleed so heavily that it could be life threatening, or sometimes we might have to remove their uterus just to save their lives.
Dr. Usha told us this is high risk pregnancy, but we have all the facility available in Prime to take care of baby and me.
Now, Kamaljit was also only 32 weeks preterm, and they were really worried when they came to us, and they were kind of thinking, should they go to a different hospital for this care? What I said to them that Prime was completely, equipped to deal with it. When I say completely equipped, such cases should be dealt only in a center which has got a multidisciplinary services available. Now we have a good gynecology team that includes myself, who's adept in doing this kind of surgeries. We also have a very good anesthetic team to deal with this case, a blood transfusion services, which is the hematology services, and neonatal services, which is to take care of the preterm baby like this, and also the ICU if required. Luckily she did not require any of it. And also we do have interventional cardiology services, which sometimes can be required in such cases to embolize the uterine artery.
We were discharged in about 3 daes after the surgery. And,
Yes, you can see me. I'm perfectly fine now.
Yeah, and thanks to Prime Healthcare Group for getting us to the right spot. Thank you again to Dr. Usha for taking care of us, and we're now a happy family welcoming our
Yes.
son.
We managed this case extremely well. I actually met with all the concerned team and explained this to them about how high risk it is and how we need to manage it, and everybody was on board. The team was on board, and we did the cesarean section for her. Baby was taken to the NICU, and surprisingly, with the techniques that I used, the surgical techniques that I used, we managed to actually reduce the bleeding to almost like a normal cesarean section. She didn't have any extra bleeding at all. And after that, she did not require to go to the NICU. Our anesthetic team managed her very well, and the NICU managed the baby very well, and she went home in 2 days. Obviously the baby took a little longer to go home, but everything was perfectly fine.
I was first-hand witness to how they took a real good care of my wife. I was with her during her stay in the hospital. The support staff was just amazing, and the care was truly personalized.
So when I met Kamaljit first time and her husband, they were really stressed out. They had no idea what was happening, and they were really worried that such a high risk case was there, and they didn't know she was bleeding very heavily. But however, throughout the course, how we managed, they felt very reassured when I explained everything to them. And after the surgeries, they were so thankful that we did it so well, and even the nursing team and everybody else looked after them so well. They were really very grateful to us.
I can finally say that Prime is all about personalized care personally.
The most satisfying thing throughout this experience is that when you see the patient and her husband and the whole family with the baby so safely and so happy, it really makes it worthwhile trying to deliver this service, which I think is very personalized for each patient in Prime.